My name is Victoria Uka. I'm a registered nurse midwife in Nigeria. I also work with the Department of Nursing Science, University of Calabar, Nigeria. I'm currently undertaking a PhD at the University of Manchester, majorly in midwifery. I've worked in different capacities as a nurse, midwife, and as a lecturer, and I've authored and co-authored a few publications in my area of specialty, which is midwifery, majorly with sexual and reproductive health.
Brilliant. Thank you very much, Victoria, for that introduction there. So, currently, you're a second year full time PhD student here at the University of Manchester. Can you tell me a little bit about the work that you're doing as part of that PhD?
Yes, my work is centered on the nature of provision of sexual and reproductive health services to young people in a semi-urban area in Nigeria. And I am interested in this work because I have passion working with young people. I've been working with young people right from my undergraduate level work up till my master's and now my PhD. I'm still working with young people. Young people face considerable health risk because biological and social factors places powerful influence on them, and this makes them vulnerable to sexual and reproductive health issues such as unwanted pregnancies, sexually transmitted infections, and more. And so, also political, social, other factors place restrictions on their ability to access quality sexual and reproductive health services. So, this study intends to identify gaps that are there in sexual and reproductive health service provision in order that we can be able to identify those areas that can be strengthened and supported and be able to afford young people the accessibility to quality sexual and reproductive health services.
Brilliant. Thank you very much. I believe currently you are doing a systematic review to start that off. Do you want to tell us a little bit about that?
Yeah, it's part of the study to do the systematic review. We want to identify gaps that are there in literature. We want to see what the young people are saying regarding sexual and reproductive health services, what their preferences are. This will inform the qualitative study that will enable us design the study that will focus now on healthcare providers to tell us their experiences, their practices regarding sexual and reproductive health services. And we can be able to see, is it in line with what WHO is saying, or is it in line with what the youths are saying? What do the youths want? What is the appropriate practice so that we can encourage young people utilize these services?
Brilliant. So, just to summarise there, you're doing a systematic review, first of all, currently, looking at the needs and preferences of young people. And then you're going to use that to design a qualitative study, speaking to care providers in Calabar South Community region in Nigeria around the delivery of sexual and reproductive health services to young people. Can I ask, how did you become interested in that as a topic area?
I would say I have a strong passion for young people's sexual and reproductive health, and that was what informed my topic during the master's program. I did something on the utilization of sexual and reproductive health services, and it was found that young people were not using the services. So at this point, we want to see how we can be uh, involved, actively be involved and make sure that young people are actually accessing the services.
So, other people might be listening to this with the same passion that you just showed there for this topic area. How can other people maybe become involved in this work?
Yeah, primarily, we intend to involve healthcare providers. They will give us their opinion concerning what is the current practice, their experiences with providing sexual and reproductive health services to young people. And then at the end of the day, whatever finding or whatever gaps we are able to identify, we will be able to do a public engagement workshop, seminar with all stakeholders, including decision makers, the chiefs of the community, and young people, so we can see how we can mingle and come up with ideas that will enable us design interventions, workable interventions that will encourage young people, utilize or access quality sexual and reproductive health services. Yeah.
Brilliant. Some exciting stuff to come. So if people have heard that and think, oh, I definitely want that to be in my area, how can they get in touch with you?
Yeah, you can get in touch with me. My email address is victoria.uka at postgrad.manchester.ac.uk. Victoria is spelled Victoria dot UKA at postgrad.manchester.ac.uk.
Can I just ask, what do you hope to gain from this work? Like you've said there a few things about public engagement and different things, but over the next rest of your PhD, the next 2-3 years, what do you hope to gain from this work?
Well, I hope to gain skills, more knowledge, to be able to be an independent researcher, to be able to mentor students as an academic. I need to be able to transfer this knowledge and skills, make students gain, student nurses and midwives gain competence in addressing, young people's sexual and reproductive health needs and their preferences. I also need to be able to collaborate with the international world, with non-governmental organizations who have young people as their target population.
Brilliant. Thank you very much. So, just finally, if anyone's listening to this and they're thinking, wow, that's exactly the type of career I want, this sounds absolutely fascinating, I would love to do a PhD or some of the other things you've mentioned, what tips would you have for them?
Yeah, I would say, it's a journey, and a journey cannot be achieved in one day. You just have to take it step by step, one step at a time, with commitment and hard work. You see yourself there. Yeah.
Brilliant. Thank you very much, Victoria.